Good afternoon, and thank you for joining us. Today is Tuesday, January 18th, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and Mayor Johnson, I'll hand things over to you today.
All right, well, good afternoon, everyone. On the mask ordinance, earlier today, folks may be aware that the Common Council passed a mask mandate for the city of Milwaukee. I believe that what's been passed is reasonable. The duration is limited. It strongly enforces what I've been saying all along, which is to wear a mask, because there had already been a mask advisory in place. This essentially puts that mask advisory on paper. And even more importantly, besides masking, to get vaccinated. That is the #1 tool that we have to mitigate the effects of COVID-19 and keep hospitalizations low. So I anticipate signing it when it does reach my desk. The health department continues its distribution of N95 quality masks into the community. In partnership with Milwaukee Public Schools, the health department is providing 300,000 of those high quality masks to schools, 100,000 of which are children's masks. The additional 120,000 masks will be provided to private schools as well. The health department has exhausted its allotment of N95 masks from the state's Department of Health Services and will no longer be providing these masks to the public at its community testing and vaccination site. So we've already given out 1 million masks over the course of the past week. And at the end of this week, the health department will have distributed a total of 1.5 million N95 quality masks to the community through individual and school-based distribution. An update now on our COVID-19 gating metrics for the week. We remain in the extreme transmission category for COVID-19 cases per 100,000. That's up 1,379 cases per 100,000. And our percent positivity rate also remains in the extreme transmission category, down 28.3%. For vaccination rates, 61.6% of all adults in the city of Milwaukee, those are individuals 16 years of age and older, are fully vaccinated. 67% of all adults have received at least one dose, and 39.2% are fully vaccinated along with the booster. The state's Department of Health Services completed an update of the data management system to manage the increase of positive cases due to the current surge. As a result of this updated process, the Department of Health Services expects COVID-19 data to be temporarily elevated over the next few days while these backlog cases are entered. For clinics coming up in the community, I'd like to say this, I cannot stress enough how important vaccination is to keeping residents out of the hospital, including reducing the spread of COVID-19 in our community. To help increase the vaccination rate for our 5 to 17-year-olds, the health department is again partnering with Milwaukee Public Schools to provide vaccines through school-based clinics. Just last week, the health department was at Fratney School, where it was able to distribute over 300 doses of vaccine, a majority of which were administered to children. This was the most successful school-based clinic to date. So congratulations to the health department, as well as to Fratney School. The formal schedule of school-based clinics begins Wednesday on the 19th of January and will run through February the 8th, with one MPS school hosting a vaccine clinic each day. This schedule will repeat from February 9th until the 29th to allow participants to access second doses. The clinics will be open to the public, so both adults and children can access COVID-19 vaccines as well as a flu shot. The full schedule of school-based clinics can be found at milwaukee.gov/COVIDvax. Here's a brief summary of the mobile vaccine clinics for this week. On Wednesday, which is tomorrow, January 19th, from 1 p.m. until 4 p.m. at Alexander Mitchell Integrated Arts School, from 1 p.m. to 4 p.m. at Ascension All Saints Family Health Center. On Thursday, January 20th, from 2 to 5 p.m. at Morse Middle School for the Gifted and Talented, Friday, January 21st from 1 p.m. until 4 p.m. down at Clement J. Zablocki School, and on Monday, January 24th from 1 to 4 at Grant Gordon Learning Center. Vaccines and boosters are always available at the health department's community locations at the Northwest, South Side, as well as Menominee Valley sites as well. Thank you.
All right, good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 1,362 new cases per day and about 6 deaths per day. Our COVID trends are a bit of a puzzle at the moment. So on one hand, we have data from the state on the DHS site showing a sustained increase in our cases, in fact, with several recent record-setting days. Now, it's important to note that the state shows data of cases confirmed by the date confirmed, wherein the large numbers are therefore reflecting the processing of a backlog of cases. So not necessarily the disease burden on that specific day. Now, on the other hand, our own county dashboard is showing a bit of a downtrend. And there is indeed a downtrend in positive cases being recorded, but that's accompanied by a downtrend in the amount of testing. It's all a bit complicated, but it ends up being that our best metric may be positivity, which, while still extremely high, is on the decline, and a welcome decline to be sure. Now, however, our hospitalizations, while showing some signs of stabilizations, are also at critically high capacity, putting severe strain on our health systems. And we are continuing to see an increase in deaths. Now, looking at states around us, we're likely near our peak from this current surge from Omicron. But as with every other surge, it'll take longer to see those hospitalizations and those deaths start to meaningfully decline. Now, there will be a time for reflection on this surge, but what it means for the future of COVID and what is on the horizon for the future of the pandemic. At the moment, however, we still remain at a time of critical transmission, critical disease burden, and critical health system capacity. Now, there's a question that comes up a lot, and I think with the city's newly passed mask mandate, this question will come up more and more. And it's with Omicron appearing to be a more mild, but substantially more transmissible variant, why not just let it rip, take off the masks, stop the distancing, and build up enough immunity to end the pandemic once and for all? Now, this seems like a reasonable option at first glance until you let it play out on the individual and community level. We can start with you. No matter who you are, if you get COVID, you may get sick. Now, certainly you may not get hospitalized, but it's worth remembering that mild COVID often doesn't mean mild by many of our standards. Several days or even weeks of body aches, fever, cough, chills, and shortness of breath is not mild by many standards. And that does not consider the potential long-term effects of COVID that can occur in as many as 20% of people that get infected. Now, even if you're willing to take chances with yourself, you have to remember about the many folks out there who are not as protected. 7 million people in our country who are immunosuppressed. All the kids under 5 who can't yet get vaccinated. Older people who, regardless of vaccine and booster, remain vulnerable. All of those people also have lives to lead, families who care for them. And of course, you have to consider our health systems. Even now, with mitigation strategies in place, our health systems are overwhelmed. Surgeries are canceled, clinics are closed to redeploy that staff to hospitals. ICUs are full and emergency departments are backed up, causing delays in patient care. Our health systems serve everyone, including you. You may have a chronic medical condition and need care, or you may be healthy but have an unforeseen accident and need treatment. We all depend on our health systems, and letting COVID spread unmitigated would easily collapse our already fragile hospitals. Now, even considering all that, let's say you're of the viewpoint that those risks are worth it to build up immunity in the community and bring the pandemic to an end. The problem is all that may be for nothing. The next variant may not care about your past immunity. Turns out Omicron doesn't much care if you had Delta or Alpha in the past. All that's to say we need to continue to be cautious, to distance, to mask indoors with high quality masks, but not forever. We need to get through this surge, and we will likely do that in the coming weeks. And then we need to regroup, to reevaluate, to follow the data, and to learn from this variant and this last surge to increase our vaccination rate locally and globally. And that's how we end the pandemic. We're all tired, we're all frustrated, we're all ready for this to be done, but the virus, unfortunately, is not done with us. So we have to keep fighting and keep protecting the vulnerable people and institutions in our community. And finally, please be kind to each other, whether it's in testing lines, on social media, in the hospital, in the grocery store. This is hard enough for everyone. We have differences of opinion, but the least we can do is show kindness to others. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. Earlier today, the Milwaukee Common Council passed a mask ordinance for the city of Milwaukee, which will go into effect in the next few days. Under this ordinance, any individual 3 years of age and older is required to wear a mask or face covering when inside any building open to the public. The ordinance has exceptions for settings where a face covering is not practical, such as while actively eating or drinking, receiving dental or medical services, or actively engaging in a sport or performance. At this time, the ordinance is set to expire or be revisited by the Common Council on March 1st, 2022. The Health Department previously issued a mask advisory on November 30th, and our position on the importance of masking has not changed. It is important everyone is masked indoors in public. High quality masks such as N95 and KN95 provide the highest level of protection, but if you don't have access to these types of masks, if you double up your face covering, you can add additional protection. Additionally, N95 and KN95 masks can be reused if properly sanitized between uses. To sanitize an N95 or KN95, place it in a breathable paper bag, close the bag, and allow it to sit at room temperature for at least 72 hours. This process can be repeated, but should not exceed 5 times before the mask is disposed. We know that access to the high filtration mask has been a challenge, so the ability to get maximum usage out of each mask is important. We were encouraged by the outpouring of community members who took advantage of the free mask distribution campaign last week. The Milwaukee Health Department distributed 1 million free N95 masks directly to the community. We are also providing masks to schools in Milwaukee, both MPS, the City Forward Collective, and other private schools. We are on track to distribute 1.5 million masks by the end of this week. Thank you to Wisconsin DHS for providing the masks to Milwaukee, to my health department staff, and to the Milwaukee Public Library staff who distributed the masks. The Milwaukee Health Department remains committed to providing COVID-19 vaccine and tests to the community, but the addition of masking just provides an additional layer of protection while we all work to reach higher vaccination rates. Those in need of a COVID-19 test can visit milwaukee.gov/COVID testing for information on Milwaukee Health Department free drive-through testing sites, and there is no appointment necessary. The surge in testing demand that we experienced over the holidays has begun to decrease. During the peak holiday demand, the Milwaukee Health Department was administering on average 1,500 tests a day, which has decreased to around 800 tests per day. Our testing lines have decreased significantly. For other verified testing sites, please visit healthymke.com or DHS's website. In addition, COVID tests are now available online. You can order them at covidtest.gov. There is a limit of 4 tests per household. These are rapid antigen tests. Registration's online, and they will ship within 7 to 12 days. Thank you and stay safe.
Thank you, Commissioner. At this point, we'll move into the media Q&A portion of our briefing. Our first question comes from Drake Bentley with the Milwaukee Journal-Sentinel. His first question is for Dr. Weston and Commissioner Johnson. He's wondering, do you believe we've peaked in COVID cases among Milwaukee school kids?
I'll start.
Dr. Weston,
I'll start. I was just trying to pull up the data here. I think it's hard to say with back to school happening so recently. I'm sure in an environment like that, there will be some degree of spread. Anytime you have people indoors, there's some degree of spread. I think there's a lot of mitigation measures in place. to decrease that spread. But it's hard to say whether we've peaked as a community in general. It certainly seems that looking at the data, combining what we see locally with what we see as a state, with what we see at other states around us, I think we're certainly nearing the corner where we're going to turn the corner and start seeing a decline, and hopefully a pretty substantial decline, as other communities around the world have, in Omicron. And I think that'll be similar in schools once we start to see that decline as well.
Excellent. Drake's next question is for Mayor Johnson. He says, is there any concern about returning to in-person classes?
Great. Well, I think Dr. Weston touched on that a little bit in his remarks. I will go on to say that, I think the best place for kids to be is in school. And so we should do everything that we can to make sure that kids have the opportunity to be in an in-school setting. Now, the health department and particularly Commissioner Johnson's worked very well with schools, all schools in Milwaukee in order to make sure that they have masks and there are mitigation strategies available to them. And so there certainly are some concerns that Dr. Wesson mentioned, but overall, I think that the processes that have been established before were working, will continue to work. And the fact that, especially for Milwaukee Public Schools, that there was an extended time away will allow for chances for transmission to be lowered as well. So I'm glad to see that kids are back in school. That's really cool.
Next question comes from Kent Wainscott with WISN 12. He says, Commissioner Johnson, you previously had expressed some skepticism about the effectiveness of a mask ordinance because it's limited to the city's boundaries. Do you have the same reservations about the new ordinance?
I do think there are challenges because obviously it only impacts the city, and as we are well aware, our city borders a number of other municipal, other cities. So I do think that's challenging. That said, I ultimately, and again, our stance has not changed. People should absolutely be masked indoors in public, and I think this ordinance just makes that official. We're asking people to mask indoors in public, and it's critical to protect some of our workforce and to protect those who are most vulnerable.
Our next question is from Eric Gunn with Wisconsin Examiner for Dr. Weston. He asks, how useful is wastewater surveillance as a leading indicator for pandemic trends, and what is the data showing?
Yeah, the wastewater collection data has been really interesting. So we have in Milwaukee County 2 main sewer sheds. So these are areas where the sewage water kind of all collects. And what you can do is you can sequence that sewage water and look for fragments of the COVID virus, the virus that causes COVID. And so when you see higher levels, it suggests higher levels in the community. I think one of the questions is, as you ask, what's the utility going to be of this? Is it predictive? Is it responsive? Certainly we're seeing, and this is on the DHS dashboard, we're seeing higher levels of virus in the wastewater, of COVID in the wastewater recently than we've ever seen before. And that reflects the higher number of cases than we've ever seen before. So it certainly goes along with the burden of disease in the community. And it does look like those numbers start to rise a little bit before our community rates start to rise, which would make sense as well. So I think now it's an interesting value to look at. It's an interesting predictor to look at. I think in the future, once we enter more of a steady state, it'll certainly be a very interesting data point to look at, to see, even if people aren't testing as much as they are now, to get an understanding of what the disease rates are in the community.
Our next few questions in the chat are for Commissioner Johnson and Mayor Johnson. Our first one comes from Rebecca Clough with TMJ4. For Commissioner Johnson, she wants to know, will the health department be enforcing the mask ordinance with fines and other enforcement?
So there are no fines tied to the mask ordinance that was passed today by the Common Council. We frankly, and I've said this repeatedly, the City of Milwaukee Health Department, we are really limited on our staff, much like healthcare. We're heavily focused on testing and vaccination efforts. And so at this time, we do not have the capacity to enforce it, and we're going to be collecting information as calls come in. But that is the most that we can do right now.
I'm not sure if there's anything else to add, but Ben Wagner with WISN 12 is wondering, where he states that one of the ordinance sponsors says a business license could be affected if they don't require masks. How will this be monitored and enforced?
So again, we're just at this point going to be collecting the information as the calls come in, and sort of look at the data and see where we stand. And again, our staff simply doesn't have the capacity to do enforcement.
And Mayor Johnson, Ben Wagner wants to know, when do you expect to sign the mask ordinance?
It is not yet gotten to my desk. So I'll be waiting for that to happen. It's just not gotten here yet.
And Mayor Taylor Lumpkin with TMJ4 is wondering, what was the deciding factor for you to be in favor of and want to sign the mask mandate?
Well, I have been consistent on these calls and in my communication with alders all the while about the concerns that I had, and trying to get us to a point where I could sign a ordinance. And those things were, again, pretty consistent, that it had to be focused on education and not be punitive. We should be working to make sure that we're educating folks on vaccines, because while masking is great, and we had an advisory in place, and that's essentially what this is on paper already, we should be pushing people towards education and vaccinations. That's how we're going to make sure that people's symptoms are low, make sure that hospitalizations from COVID remain low as well. The other thing was that there's a specified end date for the mandate. It does not go on forever and ever. There's a specified time that the council will be able to review it, as opposed to it, just going on. And in fact, the council could also, by virtue of special meeting, review it even sooner than what the legislation calls for. I wanted to make sure that the legislation also was not done in a political sense. I think that's not what we should be doing. We should be leaving it to the experts on COVID-19 and the professionals in the Milwaukee Health Department to make those decisions, and that there was sign off from the health department. If it met those criteria, then I'd be interested in signing it. And I think this legislation has done that.
A few follow-up questions here, if there's anything else to add. The first question comes from Allison Durr with the Milwaukee Journal-Sentinel for Mayor Johnson. She wants to know, what are your thoughts about the efficacy of enforcement solely through licensing? Would you like the health department to perform any enforcement, or is that simply not a priority right now?
It's not a priority. I think, again, the thing that we should be focusing on is education, and pushing people to get vaccines. Masks are fine to wear indoors. However, if we're going to beat this and we're going to make sure that hospitalizations remain low, folks need to get vaccinated, including, as we were talking about, kids been in school earlier. If we want kids to remain in school, then the adults in their lives have to do the right thing and make sure they get vaccinated. And so that's the message here. So I'm not interested in the health department being punitive towards businesses or being punitive towards individuals. What I would like to see is education and a push towards vaccination.
And Commissioner Johnson, Allison would like to know, what do you anticipate in terms of compliance with the mask ordinance, given the March 1 sunset and enforcement only, potentially through licensing? And one council member this morning called the ordinance a paper tiger.
I think we're hopeful that businesses will be asking their patrons to mask. All businesses, whether it's retail, a coffee shop, a restaurant, the Pfizer Forum, which is already asking people to mask. Again, in terms of enforcement, we, as Mayor Johnson said, are really leaning into education and encouraging people to wear masks. Again, our stance has not changed. Masks are critical in public spaces, especially right now with the virus circulating at such a high rate. So again, we don't have the staff to do it right now, and we are really focused on testing, access to tests, and vaccination.
Our next question is for Commissioner Johnson from Jason Calvi with Fox 6. He's wondering, this ordinance includes no fines and says the health department may take action, including the possibility of sending a letter, talking to the business, and then visiting and putting a note in that business's license file. How many staff members do you think these tasks will require, and do you have people ready to go?
So to my previous point, I think it would take quite a few staff. We'd have to put together an entire process and staffing to address this. And no, we don't have the staff. I think I'd rather, our messaging all along has been, we have got to get more people vaccinated. And I think that's where we should be putting our efforts.
All right, and it looks like our, okay, so I'll stick with our COVID question follow-up from Allison Durr. Can you speak to current educational efforts regarding vaccination for Mayor Johnson or Commissioner, if you want to chime in?
Sure, so I can speak just briefly on this. I think, we had a door-to-door effort in the fall. We plan to reorganize and have that again this spring, summer. So door knocking, and then we have our Crush COVID crew that's available. There's a lot of social media. And I think ultimately at this point, there are a lot of one-on-one conversations that are happening to share information with people.
Thank you, Commissioner. All right, I will circle back to Christine Hatfield's question with Wisconsin Public Radio for Mayor Johnson. The Talgo train sets originally built for the state of Wisconsin are going to Nigeria to use in a metro system there. What are your thoughts on this transaction?
Well, I'm happy for Talgo. I'm happy for Lagos in Africa. As I said this morning, it's a little bittersweet. I'm glad that the trains are gone. They were manufactured here. Talgo employed a lot of folks and continue to employ a lot of folks in Milwaukee. They've changed their business model, not just to manufacture trains, but also to refurbish train sets as well. They have a number of sets from Los Angeles commuter rail that they're currently working on. There's opportunities to extend those sort of contracts to keep people in the city of Milwaukee working in family supporting jobs, and that's great. Look, when I was getting out of college at UW-Madison, I saw a ecosystem and a economic ecosystem that could be sustained with ideas coming from the university, the financial might of Chicago, and the manufacturing know-how of Milwaukee. And that's a self-sustaining ecosystem, and they were to be connected by high-speed rail, which would keep people employed here. And we lost the opportunity to do that. Now, those conversations haven't gone away, and I hope that at some point we're still able to realize that vision for a more connected, community and tri-state or area here between Chicago, Madison, Milwaukee, and even farther beyond. But unfortunately, it just didn't happen. So I'm sending my congratulations to the governor and Lagos State in Nigeria, but also, a little disappointed that we missed out on the opportunity to have those train sets operating here in Milwaukee and in Wisconsin.
Thank you, Mayor. Those are all of the questions we have in the chat. So that concludes today's briefing. Thank you all for joining us. Thank you, media, for the questions, and we will see you next week.
Thank you.
Thank you.